Premier, thanks for your time. Here we are again, going to the festive season with infections that are quite worrying. What are your plans to try to keep things at bay or control the situation?
So good afternoon, Sean. Thank you very much. I must say it feels a lot like déjà vu going into the season, and our numbers are climbing. As of yesterday, we were not in the fourth wave. We were in the resurgence stage with about 665 cases a day. But as of 1 o'clock today, we moved into the start of or officially into the start of the fourth wave with 1,100 cases. Of course, it's still at the early stages, and the big question is we don't know enough yet about Omicron and how severe it's going to be. We know that there's more and faster infections. We have some good vaccination levels on people in our province who are 50 years and older. So, of course, that is going to play a significant role in protecting severe cases and death and protecting our hospitals primarily. But our preparation, we have got fully stocked oxygen across the province. We have already opened up our Hospital of Hope, which is our big field hospital, the Brackenfell one. We also have got triggers now that would then, if that hospital starts to pick up numbers, once we get to 50%, we will open up the other field hospitals in Mitchell's Plain. We also have on standby our field hospitals out in George, the Harry Kamei Hospital, as well as the one out at Sonsstraal in the Winelands. But they are all sort of on standby, not open as yet. They will open as the triggers start to open them. We've re-looked at the triggers, of course, making assumptions that we will have less cases in hospital, but we will watch it very, very closely. And as those numbers start to pick up, we will make sure we've got more beds available. At the moment, we're sitting with 6% of our beds taken up in our hospital system. But also we know that the hospitalization is a bit of a delayed factor compared to infection. So we really are watching it very closely. I've enacted already our weekly extended cabinet meetings, so they will happen every single week. Our sort of normal year-end cabinet has finished, but I've reenacted this. This is where mayors, municipal managers, and our provincial government, the different departments, as well as police, etc., all come together every week in that cabinet meeting. So that's already been enacted.
Yeah, so you obviously are already working pretty hard to make sure that things don't get out of hand. In terms of monitoring places for how they stick to COVID-19 regulations, is that happening? Because I already know so many of my friends are in Cape Town having the time of their lives while I'm out here in dry Johannesburg. I'm being a bit jealous. But do you have anyone monitoring those places to make sure that the protocols are observed?
Yeah, absolutely. We are also continually meeting with our business chambers, with our law enforcement people, and also calling absolutely on our citizens to play their part. I have already engaged last week with all of the new mayors across all of our municipalities and said to them, specifically in the hospitality sector, let's move anything that's indoors, outdoors. Of course, we know that it is much safer to be outdoors, and we keep on saying make sure that we're watching those gatherings. I also think that a big drive at the moment is, as you see the infections start to come up, more and more people are being infected. And I think it is now much more a consciousness thing. I did see many people relaxing in the last few weeks when we were at the bottom of the curve. We really had very low numbers. But now, I mean, just give an indication, we were sort of between 2 and 7 hospitalizations a day. We're now up to 19 hospitalizations. And of course, as I said, with the 1,100 infections every day, more and more people know of someone. And so the call is also not only for policing it and managing it that way. We need citizens to be playing their part, business to be playing their part as well.
Yeah, let's talk about vaccinations, because that, of course, is the biggest defense to COVID-19 at the moment, outside of wearing a mask, washing your hands, etc. How is that going in the Western Cape, and have you been able to convince people who are hesitant?
So, as I said earlier, I mean, we've got some areas in the province which I'm really proud of. I mean, in the Overberg, we're sitting, these are 50 years and older. Obviously, that's the most at risk, those citizens and citizens with comorbidities. We're sitting at the Overberg with 75.3% vaccinated, Gardenwood with 66.5%, Cape Winelands was 59.4%, and the city of Cape Town at 58.5%. So averaging, 60 and above, which I think is a good number, will give good protection, although we are pushing hard to say we need to get to the people that have not had the opportunity. We also see that it's already 95% of our vaccinations are in the insured population, which means the uninsured population sitting at below 50%, and that's where a lot of work has to happen. It's definitely in poorer communities and communities without access. We've changed our big CTICC vaccination site has been closed down last week. We've moved out into what we call vaccine taxis, pop-ups. We have been now for 2-3 months going out to citizens. So we'll put up a pop-up vaccine site at a soup kitchen. Anywhere where anybody contacts us, we will move out there into communities with those vaccine sites. We also have done is a lot of our doctors are volunteering in a program which we call Ask a Doctor, because many citizens just want a little bit of advice around the vaccine. And so many of our doctors, and I'm really grateful to that and must thank them, they are out in our shopping centers, they are out, in our taxi ranks, they are in places where citizens move, and they are there to say, let me help, can I give you some advice? And that's had a very good conversion rate. But I think at the end of the day, it really is about accessibility. If you've got your last few rand, you're not going to take a taxi to get a vaccine. You're going to put food on the table. So we've got to bring those vaccines to you.
Yeah, is that working? How many people are coming out? Just say you take one of those campaigns to Khayelitsha or anywhere on the Cape Flats, for that instance. Are you seeing people come out of their homes to actually get vaccinated? What are those numbers looking like?
Yeah, absolutely. So I watch the vaccine taxi very closely. So this is... someone the one that I was personally at the other day was in Gugulethu. A lady runs a soup kitchen there. She said, can we have a vaccine taxi? I arrived there. It's a converted ambulance. A tent is set up outside, and you're doing between 100 and 200 people every time you set that up. I got some data today out of Manenberg. I got some data that shows that between 100 and say 250 is the average number that these mobile units are picking up. They're doing loud hailing and definitely working, but of course it's much more to get into the communities. You've got to have more of these. I think another 9 or 10 have just been brought online. So we have quite a few of them going out. We've also got the mobile units in shopping centers, definitely are working. But it's a slow process. It's not mass vaccinations, because you've got to take them to a few roads or a few streets.
Yeah, and on average, how many people are you vaccinating daily?
So we're sitting just over 20,000 a day. It dropped down to about 15,000, but we have the capacity of in excess of 40,000. But so at the moment, it's 20 to 21,000 a day.
Yeah, that's still not, as high as we would like it to be, isn't it, Premier? So lastly, the Omicron variant, have you been able to pick up just how widespread it is in the Western Cape?
So obviously, early on we were doing the sampling, and we could see already that it was a great percentage. Our epidemiologist is saying it's the predominant driver of infections at the moment. So, and we can't do the tests every single square meter of the province, but I think the percentages show that it is the predominant driver of vaccination. So we must just assume that it is present in almost all cases at the moment.
All right, thank you so much for your time. I'll see, I'll be in Cape Town at the end of the year. Western Cape Premier Alan Winde.